Hi, my name is Nicholas Briley, and this is the Week 7 assignment on acute lymphoblastic leukemia. The purpose of this presentation is to help increase the awareness and knowledge of acute lymphoblastic leukemia within my community. Acute lymphoblastic leukemia, also known as ALL, is the most common form of leukemia found in children and affects mature lymphocytes. The role of lymphocytic cells is to protect the body from infections and diseases. As you can see in the picture below, ALL patients have overcrowded lymphoblasts compared to the normal patient. Those with ALL have too many lymphoblasts, which overcrowd the normal infection-fighting white blood cells. Infections can spread to major vital organs in your body. These infections pose major risk factors to vital organs throughout the body. Some of the most common signs and symptoms seen in ALL: patients with bleeding, bruising, anemia, bone and joint pain, recurrent fevers and infections, swollen lymph nodes, abdominal pain, and difficulty breathing. Most symptoms are due to bone marrow being overcrowded by lymphoblasts. Bleeding and bruising happens because not enough platelets are produced. The anemia is caused by overcrowding, which lowers the red blood cell count. Recurrent fevers and infections are also consequences of lymphoblasts that cannot fight infections. ALL cells are typically found collected in nodes, which is why they swell. And difficulty breathing is caused by ALL cells collected in the thymus gland pressed up against the throat. ALL can be caused by genetic mutations prior to birth, but there are risk factors that can predispose a person, including sex, race, exposure to radiation, and carcinogens. Common characteristics of those with ALL are young children ages 3 to 5, females, and Hispanics. Some risk factors are unpreventable since they are random genetic mutations, but some risk factors can be prevented, such as not exposing your in utero child to radiation and not smoking tobacco products. Blood tests will determine what percentage of each type of blood cell is present, specifically the lymphoblast. Bone marrow test aspirates a sample of bone marrow to specifically look for leukemia cells. Imaging involves an X-ray, CT scan, or an ultrasound to detect leukemia cells spread throughout the body. Another method of diagnosis is collecting spinal fluid from the spine to determine if there is presence of leukemia cells in the spinal fluid. Unfortunately, there are not many ways to prevent ALL since it is a random genetic mutation, but avoiding radiation and carcinogens can help reduce the risk. In conclusion, ALL is typically found in children ages 3 to 5. This disease affects lymphocytes and creates overcrowding of immature lymphoblasts, which prevents the fight of infections and diseases. There are multiple tests available to determine the presence of leukemia cells in the body. And finally, there is no definitive prevention, but there are ways to decrease the risk of ALL. And finally, listed are the references. Thank you all, and have a great day.